Good morning, everybody. It's a total pleasure to be here. Thank you for inviting me. I always start with a slide on conflicts of interest. I have no financial conflicts of interest. The slide gives full details and links to all our funding, and we give full disclosures on papers. We have a policy not to accept funding from commercial organisations whose interests are not aligned with improved public health. And just one message from me is that as we try to move forward in this area and change norms in this area, I would really encourage all of you to start presentations with a conflict of interest declaration. Okay. So we're talking today about the commercial and political determinants. And I think most of us are much more familiar with, the social determinants of health, the political and economic determinants of health. And these are really beautifully summarised by Dr. Tedros, currently Director General of the WHO. Health does not begin in clinics or hospitals. It starts with the conditions in which we are born, raised, in schools, streets, workplaces, homes, water sources, and so on. And most of us are, of course, familiar as well with the various models of the social determinants of health, such as this Dahl, Green and Whitehead model. But if you look at this, starting from the right, it refers to issues like housing, health care services, water and sanitation, the work environment. And over recent decades, there's been a shift in the involvement of the commercial sector in all of those aspects. And so it's inevitable, in fact, that the commercial sector is going to be increasingly impacting on our lives. And yet 5 years ago, in the paper I mentioned at the bottom of this slide, when we looked at existing social determinants of health models, commercial influences are largely absent. So we really need to start to understand them better. The other key reason why we need to understand them better is that the scale of commercial harm is vast. We've already touched on some of the figures for Europe. But if we look at just these 4 unhealthy commodities, tobacco, alcohol, food, and fossil fuels, the first column here is global burden of disease estimates, and the second column brings in some additional estimates. And so collectively, these account for between 1/3 and almost 2/3 of total global deaths, or 40 to almost 80% of NCD deaths. That's vast. COVID to date has caused 7 million deaths approximately, and annually the most was 2 million. And yet think of the response to COVID, it was vast. Yet annually look at this scale of deaths and what is happening, actually really relatively little. It's not because we don't know the policies that are needed. We do. They've been set up by WHO back in 2017, but they are not being implemented. And this issue really lies at the heart of the commercial determinants of health. On the right, there's a paper by Luke Allen and colleagues showing that actually progress in NCD implementation has stagnated. And in areas where these unhealthy commodity industries that I just talked about are involved, progress is actually going backwards. And that's because of corporate power and influence, including their political and scientific practices. And really, this is the sort of the crux of the commercial determinants of health. We need to understand these complexities if we are going to be able to move forward and address NCDs. And unless we do that, our health systems are just simply unsustainable. But the commercial determinants of health go way beyond just those 4 unhealthy products. I've just given some examples at the top of this slide of other products that cause avoidable health harm. We're seeing just, last week and this week in the US that, social media algorithms and the impact of guns on health. But on the left, you'll see, a sign for pharmaceuticals. And even pharmaceutical companies who on the whole, improve health, sometimes in the pursuit of profit will harm health. There are, for example, Vioxx, rofecoxib, the Merck, and it was Merck, hid the cardiovascular harms of that product. With the COVID vaccine, despite huge public sector involvement in its development, it was priced such that particularly low middle income countries could not afford to vaccinate their populations. So a whole host of other products cause harm. And then corporations can also cause preventable harm and inequity, regardless, in fact, of their product through their practices. And there's just a few illustrations at the bottom of the slide. So on the left, accidents in the workplace. In the UK now, the 8th largest cause of DALYs, disability life adjusted years, is actually occupational risks. Amazon workers, for example, their warehouse workers have twice the rate of accidents of other warehouse workers. We saw during COVID that workers in insecure job contracts were twice as likely to die of COVID, both to acquire COVID and die of COVID. And over time, within commercial labour practices, and now actually those labour practices are seeping into the public sector, a stagnation of average worker salaries while executive salaries increase. And that's, of course, a huge contributor to inequalities. But again, we've also seen this, the shift to these insecure contracts, which the impacts on health are becoming increasingly clear in terms of anxiety, depression, as well as physical health impacts. The green illustrations in the middle are taken from Tax Justice Network report a few years back. And this is looking at tax abuse through tax havens. They estimated that 40% of multinational corporate profits made abroad end up in tax havens. And if you add into that the very so individual wealthy people, their use of tax havens, 427 billion is lost a year, and that's equivalent to one nurse's salary every second. So tax abuse can also lead to indirect health impacts. And on the right, I've got some illustrations of supply chain practices. So the first is, I'm having a blank on the tower, but this is the use of cheap but inflammable materials, cladding, the Grenfell Tower disaster. And the second is an illustration of deforestation in the Amazon. So these shortcuts to maximize profits are having impacts on human and planetary health and inequities. So to help address this whole area, recently we published a Lancet series on the commercial determinants of health, and much of what I will say today is taken from that series. And we proposed this definition of the commercial determinants of health: the systems, practices and pathways through which commercial actors drive health and equity. And what we're really trying to highlight here is, first of all, this is a neutral definition. It doesn't specify either negative or positive outcomes. And that's because, despite what I've been saying up until now, commercial actors are in fact incredibly diverse. While some are damaging to health, some actually have incredibly positive impacts on health and play key roles in society. They innovate in ways that we need through their products and their services. And actually, some of them will, of course, be essential to finding solutions to the commercial determinants of health. And we need to recognise that small and medium enterprises actually make a disproportionately large contribution to inclusive economic growth and employment. And very often that they're the victims of the same system that is driving the commercial determinants of health. And within health, of course, economies are also essential to health. So this is a complex area. And then we flag not only the impacts on health, and here we're very clear that by health we mean human and planetary health, because those two cannot be disentangled. And also equity. Until now, the impact of the commercial sector on equity, I think, had been underlooked. But just through the examples I've given you, I hope I've highlighted the impacts on equity. And that's not just within countries, but also between countries. And then we developed a model which has got three elements, and this is to try and illustrate the whole, entity of commercial determinants of health. So the first part is around the commercial sector. The second part is the determinants of health part of the model. And then we identify systems and underlying drivers. I'm just going to go through some of these very quickly. So what we've tried to do here is disentangle and categorize the different types of practices that commercial entities engage in. I've actually touched on quite a few of them already. And of course, they intersect and interact. At the top, you can see we refer to commercial entities, their growth strategies and business models. And this is to try and flag the idea that there are very different types of commercial entities. And then you can see that on the left, we've written ethical or legal round to unethical or legal or illegal. And that's because in engaging in these practices, commercial actors can engage ethically and legally round to unethically or illegally. So financial practices will vary from full payment of taxes to tax avoidance, which is legal but unethical, to smuggling, tax evasion, which is illegal. And really, it's when profit becomes the primary driver that we see this shift to more and more unethical practices. And overall, the evidence is that the largest transnational and multinational corporations are the most egregious evidence relates to those largest multinational and transnational corporations. My little arrow here is to marketing practices, because when we're talking about addressing some of these commercial determinants of health, particularly say tobacco, alcohol, food, we talk about the 4 A's, addressing the affordability, attractiveness, availability, and accessibility, which we must do. You know, that's absolutely essential. But really, that just addresses marketing practices. And one of the problems we're facing is that trying to get those policies in is really difficult, because we're not necessarily thinking about these broader practices. And so we need to sort of open our eyes and take a far more critical approach to the social and political determinants of health, which is really what the commercial determinants of health are about. You can't separate the social, political, commercial. The commercial determinants is about taking this critical lens and saying, why are things not progressing and what can we do about it? What role is the commercial sector playing here? So let me just flag a couple of these practices. So some that are absolutely key to moving the commercial determinants of health agenda forward are the political and scientific practices. And our evidence is very clear here that major corporations across different industry sectors consistently use their political and scientific practices to oppose public health policies. Not only that, but actually they engage in the very same practices. So in science, we looked across the board, and you know, we can tell you all of those companies that we've mentioned, plus chemical industry, gambling industry, and so on, engage in the same practices. And for political practices, so far we've looked at tobacco, alcohol, gambling, ultra-processed foods, and we're currently looking at the fossil fuel industry. Again, they engage in the same practices. And yet it's only in tobacco control that we have a different governance approach where we exclude the tobacco industry from policy making. So why is it that we treat the tobacco industry differently? That makes no sense. I want to talk very briefly about reputation management practices. These are often also known as CSR, corporate social responsibility. And the reason for this is these are hidden. You know, we've positioned this right in the middle because it overlaps with it and is central to all those other practices, particularly for commercial actors whose products are damaging to health. And I want to talk about it because it gets overlooked. So corporations, particularly those ones causing harm, use this to distract from their harms. The illustration at the top is from Philip Morris International. So a few years ago, the Department for Environment, Food and Rural Affairs here in the UK was looking at a mandatory levy on the tobacco industry to cover the cost of the litter they cause. And so Philip Morris developed this campaign, Clean Up Britain, writing to the national and local governments saying, oh, you know, we can help you sort out, you know, the litter problems. It was clearly deliberately intended to try and prevent regulation. But of course, it was misleading. The picture on the website is of tires, but you know, the single largest source of single-use plastic is cigarette filters, which are also the single most littered item. So this is, you know, distracting from their harm. And then what they were intending to do, you can see in the green text, smokers who drop cigarette butts will be made to watch the video that shames them. So this was about shaming, blaming individual smokers. So again, this is something that they will always try to do, use what they call altruism and philanthropy, which actually doesn't work to that effect at all when you look at the evidence, to misdirect blame to individuals. And then another thing they've also been doing is funding CSR or educational materials. So this is the second image is of an alcohol industry funded organisation, DrinkAware, developing educational materials around responsible drinking. But those materials were found to encourage rather than discourage alcohol use. And yet we had a situation here where our government agencies were partnering with DrinkAware. So we have to be incredibly difficult. I know governments are short of money. They will be approached with offers of help from these sorts of organisations. But the evidence is that these reputation management practices are harmful to health. And so we need to really open our eyes to what they're up to and reject those approaches. So all those practices in turn then impact on health by impacting on different levels of the determinants of health model. And that can happen from global to local level, as illustrated in the red part at the bottom. You'll notice that this deliberately draws on the Dahlgren and Whitehead model, you know, to show a rainbow. And that's because what we're trying to illustrate is that health is impacted by these factors which are increasingly structural as we move towards the outside. But so often in health, we are still just focusing at the centre. We're waiting until level 6, which is when people get ill, or we're basically, treating them. Level 5 is the final routes to health and equity. So, it's secondary prevention. We're waiting until trying to change individual behaviour, for example. But if we want to have impact, and if we want to try and reduce inequalities and be more effective and cost effective in what we do, we need to move outwards in this model. So let me just run you through some of the layers. I'm going to talk about level 4 and then move up to the higher level. So level 4 is environments. And here I've just tried to illustrate that environments are increasingly influenced by commercial actors and commercial practices in many different ways. We've actually touched on most of these. So the first is marketing. This is actually a Burger King outlet in a hospital. Supply chain practices, bottom right, we've looked at. The McDonald's promotion in school is an example of corporate social responsibility to detract from the harm. But the one we haven't really touched on is their scientific practices and the impact that has on misinformation, creating information environments that are increasingly difficult for people to negotiate. And, a future speaker will talk on that. We've actually touched on level 3 because that's about commercial sector influences on what I call downstream policies. That's health policies or tax policies or so on. But what most people don't know is using those same political practices that major corporations have also influenced what I call upstream policies. So this is in level 2 of the model. And these are the rules on how policies are made. And using tobacco industry documents, we were able to show that, in fact, diverse industries whose products were damaging to health or the environment worked collectively to push for systems of policy making known as better regulation, which are now in place within the European Union and within the UK government. And they did this deliberately to make it harder to pass public health or environmental policies. And we've gone on to look at how it operates and shown that actually that these policies do work to that effect, because what they require is early consultation with affected actors. And they require a form of impact assessment, which impact assessment can be great and is really, really important. But this is a specific form of impact assessment that focuses on impact of businesses. It's business impact assessment, and it requires everything to be costed. And what they do is they swamp the consultations with their misleading evidence. And if the government doesn't do what they want, they will then very often challenge in court. And so this has created a huge bureaucracy with it, and it has been used to slow policy making and to influence policies. And the evidence also shows, if we move up to level 1, which is political and economic systems, that major corporations and the very wealthy played a key role in promoting neoliberalism. And neoliberalism, of course, is behind this growth in commercial power, in the shift to larger and larger transnational corporations, to trade and investment liberalisation, which has led to the spread of obesity, of tobacco use and so on around the world, and the privatisation of water, healthcare and so on, sectors that were previously the remit of the state. And they did so by funding networks of neoliberal think tanks, which are still in operation, university business schools, and powerful organisations such as the World Economic Forum to help promote neoliberalism. And we will come back to the World Economic Forum. And so what this has done is created really what we call in the paper a pathological system. And this is a system where very often governments, rather than, where we've already said that commercial actors use their practices to shape this system in their interests. And governments very often, rather than regulating these corporations and acting in the public interest, often are enabling and empowering them. And this in turn means that these corporations, when they're causing harm, are then externalizing the costs of that harm. If they're not meeting those costs, de facto they are making excess profit, so their power grows. And they're using that power again to shape norms in their interest, and the system continues. And unchecked, the problems continue to go. And that's exactly what we're seeing with non-communicable diseases. So let me just try and talk you through this, this system. So if we start here, can you see the pointer? Okay. So
no.
Oh,
yes,
well.
yes, we do now. Yeah.
Okay. So over time, we've seen this shift to fewer, larger, more powerful corporations. They use their power to shape norms, and I'll come on to norms. These are, we'll come on to norms, and in turn to influence policies. And really what they're trying to do is both increase their sales and reduce their costs of doing business. And harm can come through both of those routes. So if their product is damaging to health, obviously the primary harm comes through increasing sales. But for corporations whose products are not necessarily damaging to health, the harm often comes through this reducing costs, through the shortcuts on supply chains that I've illustrated, through changing their labour practices that I've illustrated. And all of that leads to harm. They're not paying for the costs of that harm. They don't pay for the oil spill. They don't pay for the healthcare costs of obesity or so on. So they're making excess profits. And so this circle continues. The profits are privatized. The winners are on the left. Meanwhile, we've got this harm. Someone has to pay to meet the cost of that harm. So governments and publics generally pay for that costs. That reduces the resources they have available to spend on other things like housing and welfare and healthcare and so on. And in turn, that compounds the harm. And this is the situation we're in now. I'll illustrate it a little bit. So here is norm shaping. So norms are really social expectations about how we as individuals or communities and organizations should behave. And commercial actors, of course, respond to norms, but above all, they use their power to try and shape norms. And the evidence shows, for example, that over time, the shift in media coverage increasingly favours commercial actors. And it really requires substantial resources which corporations have. So here's just one example. What they've been doing is framing these complex public health problems as problems of a few misinformed individuals. You know, the problem gambler, the lazy person who's obese. Here's the Pepsi Cola chief executive. If all consumers exercised, did what they had to do, the problem of obesity wouldn't exist. I mean, we know you cannot exercise your way out of an obesity problem, and 53% of the world's population is overweight or obese. That is not a problem of individuals. That is a system problem, and yet so many of us have been led to believe that this is an individual problem. And then we have this focus on deregulatory policy norms. So this idea, you don't need to regulate, these are the good guys, just voluntary approaches or partnership approaches, often called multi-stakeholder initiatives, are the way forward. The image is taken from the World Economic Forum, which I just mentioned, and why we need public-private partnerships to address the global health challenge of obesity. And they say, no country, company or institution can tackle obesity alone. It requires these multi-sector collaborations. But actually, the evidence here is really quite clear. If you look at partnership approaches, where there is a conflict of interest, partnership approaches do not work. There's systematic review evidence on this. I've had a PhD student recently go and interview as many stakeholder initiatives working on obesity globally as she could find. The paper is published. One by one, they all say, well, ours isn't working, but I'm sure the others are. But they are not working. And so this whole thing is a sort of a piece of sort of corporate fiction. Multi-stakeholder initiatives to address obesity are not working. Voluntary approaches do not work where there's a conflict of interest. And all these, things like carbon footprint, that was coined by British Petroleum to try and shift the blame for climate change to individuals. Litterbug was framed, is a term developed by the plastics industry to blame individuals for the problems of plastic. And this is just to illustrate this huge shift in wealth or power to the private sector. So this is from the World Inequalities Report. And it shows that from about 1980, so since the advent of neoliberalization really in the late 70s, overall wealth has increased, but the share of wealth in the public sector has fallen and is now negative. The totality of wealth is in private hands. And as they say, this has got huge implications for government's ability to address inequities, climate change, health, and so on. Some other great work by Ben Woods shows that if you look at the effective tax rates on the 4 health harming industries I flagged at the beginning, over this period when harm from those industries has been increasing, their effective tax rates have been reducing. And it's not because they're making less money, it's because more and more of that money is being transferred to shareholders in the West and contributing to this private wealth escalation here. So there is an urgent need to act. So what can we do? Very often, people are, the one success area we've had, perhaps the greatest success area we've had, is tobacco control. And this is often seen as the poster child, if you like, of the commercial determinants of health. And there are two key reasons tobacco control has worked. Firstly, we've used regulation, not voluntary approaches. And we've had a key focus on governance and addressing conflicts of interest. And that's because through the Framework Convention on Tobacco Control, the world's global treaty on tobacco control under the auspices of WHO, we have Article 5.3. And I've put some of the text of the article there, but this is really about protecting policies from the vested interests of the tobacco industry. And what we've seen is global cigarette consumption has fallen, smoking prevalence has fallen in many places. But, oh, hang on, it won't move on. And so the first thing we need to do in terms of addressing non-communicable diseases and UCIs as unhealthy commodity industries is we have got to stop ignoring the overwhelming evidence that health-damaging industries engage in the same practices, that voluntary approaches don't work, that we instead need to regulate, and that there is a conflict between their interests and those of the public health. So we need an Article 5.3, which is basically a conflict of interest policy. It's basic good governance. But what we've learned from tobacco now, and I'll come on to that, is we also need a part two. We need to go beyond that to start to address the system problem that I've flagged to you. So as I've said, global cigarette consumption was going down, smoking prevalence in many countries, including our own, was going down. Industry profits were threatened. We saw e-cigarettes emerge actually being sold out of China, so as a threat to the tobacco industry. They rapidly bought up e-cigarette companies. They then launched heated tobacco products. They've been launching oral nicotine. They've invested in cannabis. Some have invested in pharmaceuticals, or now many of them have also divested. And this is because of the fear of the threat to their profitability. They then use these investments to claim they've transformed. And Philip Morris International, amongst all the other tobacco companies, has been the most relentless in this. So this is an advert it took out in UK newspapers a few years ago over the new year. We're giving up cigarettes. They've got a massive global public relations campaign that they're unsmoking our world. But yet, what is the impact of this? The decline in global cigarette sales has started to stagnate. Smoking prevalence, the decline has stalled in every world region. In many, it's still declining, but the rate of decline has stalled. If you look at the latest WHO reports, the rate of policy implementation globally has stalled. And here's some work we did recently looking at Philip Morris's sales. So we've got we're measuring their cigarette sales in two ways, one using shipments in black and one using sales, which is external data from Euromonitor in blue. The first arrow here is when they make their announcement that they're transforming. And the second line here is where they basically announce targets for their reduction in cigarette sales. So you can see there's this very fast decline in cigarette sales, and then suddenly that is stagnating. So basically their campaigns of transformation, their massive public relations campaigns, their muddying of the water seems to be working for them. And actually progress in tobacco control is now under threat. And the reason for that is this, that basically we haven't addressed the wider system problem in tobacco control. We've done a very good job within that sort of the 4A's model, regulating, but we haven't looked at the wider system problem. And if you don't address the wider system problem, these companies will fight back. They're like a balloon, so that if you squeeze their profits in one area, they will try and find profits in another area through new products. And we haven't addressed their power. So it's a system in which huge power still lies with industry. Tobacco companies remain some of the most profitable in the world. And there's a huge power imbalance between the tobacco industry and tobacco control, and between the industry and those that buy its products. And I think this fight back from the tobacco industry, the fact that progress in tobacco control is now under threat, really illustrates the fact that we have to do part one, but we also have to do part two. We have to go on beyond the NCD approach and address the system problem. And I hope we'll have time to discuss that later. Thank you.